The term asthma attack is actually quite difficult to define because it's going to be different for everybody. There's the quintessential asthma attack, where all of a sudden somebody's tubes get very tight, and without the right medication or the right technologically correct medication in the right delivery devices, tubes stay tight, and it gets harder and harder and harder to breathe. I've seen people in an asthma attack playing basketball when all of a sudden their tubes started getting tight. This one patient I'm thinking about actually reached for his asthma inhaler and started using it, but it ran out. His basketball probably was triggering his asthma attack all of a sudden, but then he didn't have the right medicine, so it continued to spiral. As it spirals, you're less able to get air in and out. And in its true form, that can be cataclysmic. This patient I'm thinking about passed out in the car on the way to the emergency room because his tubes were so tight. That's a classic asthma attack that can be easily prevented with the right medications at the right time. But there's also a different kind of asthma attack, which is much more subtle. In the doctor's office, we call these asthma exacerbations. And asthma exacerbations can last weeks or months, and oftentimes they can be subtle enough where they're not even recognized. A chronic cough, or wheezing while you're breathing, squeaking while you're breathing, or some trouble with exercise, meaning that you're not out of breath normally, but when you start to exercise, you get very out of breath and very air hungry. Those can be signs of uncontrolled asthma, and although it's not classically an attack, we would call that an asthma exacerbation. And there are medicines that can make that better if in fact it is caused by asthma.